Hi everyone, welcome to our virtual event. Thank you for joining. I'm Kara. I'm a physician assistant and the director of our wellness and longevity program here at the Body Center and Bucky Plastic Surgery Ardmore. I'm really excited to be alongside Kenny and Monette to share some more about our medical weight loss and Bucky Boost program with you all. We encourage you to stay through the end of the event, as one lucky winner will receive a complimentary 16-week medical weight loss program. You will be contacted via email if you win. GLP is a peptide or a chain of amino acids that acts like a hormone in the body. We make these ourselves and they function to regulate our blood sugar response, satiety, so how hungry we are after we eat, and the response of insulin, which helps to balance our blood sugar. So these work in a few different ways. They improve how well the cell responds to insulin, how well our body releases insulin in response to an increase in blood sugar, and what we do with that blood sugar afterwards.
Hi guys, my name is Kenny and I'm a physician assistant here. I mainly work in surgery and overseeing our wellness and weight loss program. Patients will come into the Body Center. They'll either do a consult with me or Kara down here. And then in Ardmore, they'll do a consult with Monette. At that consult, we'll go through any health history that they might have had, any medications that they're on, any allergies that they may have, rule out any of the contraindications that there are to the medicine. Then we sort of get an idea of what the person's goals are while on the medicine, whether that's fitting in clothes better, getting to a certain weight, starting to exercise more, and they need to get some of that weight off to make it easier for them to exercise. And then we sort of tailor their program around that. By using a slow and steady approach, the person's body is able to get used to being on the GLP-1, and we've had pretty much every patient be able to make it through the entire program without having any side effects that would cause them to stop. So the Bucky Boost is a microdose of a GLP-1 and then an injection of NAD. So NAD is a coenzyme that we have, but our stores sort of start to diminish once we reach age 30. And what NAD does is it provides energy to the cells and helps with regrowth of cells. It also improves brain function. So we found that pairing that with a microdose of the GLP-1, with the microdose of the GLP-1, you're getting rid of that food noise a little bit. You're also getting some anti-inflammatory aspects with it. So we found that combining these two medicines at a one-time shot has really improved patients' overall wellness. And while some of them may lose 5 pounds over the course of a few months on the Bucky Boost, the real goal of the Bucky Boost has been to sort of improve their day-to-day life, give them more energy, sort of help them avoid any brain fog or things like that. And we've had great success with that.
My name is Monette, clinical and aesthetic nurse practitioner for Bucky Plastic Surgery and the director of medical weight loss at our Ardmore location. With our program, we ensure that you are losing weight effectively and not rapidly, which is why we also offer these DEXA scans periodically so that we can see how you're progressing, making sure that you don't lose that muscle but lose that fat. Losing weight is a great thing, but patients are always concerned about losing that volume in their face or their body. So we have individual treatments that can help combat those, such as injectables. We have great injectors here. And we also have non-surgical skin tightening treatments.
People that are taking GLPs certainly successfully lose weight, but we've also identified the fact that they lose muscle, some strength, as well as fat. Medical weight loss done right uses metrics including the DEXA scanner, resistance training to maintain your muscle mass, and high-protein diets to also maintain muscle mass, surrounded by very thoughtfully applied injections, which allow patients to selectively lose fat, maintain their muscle, and we offer functional training as well to allow you to stay strong and move through your daily living while losing weight in a very effective way.
The use of hormone replacement therapy and GLPs in concert can really lead to improved metabolic and body composition outcomes that also ensure longevity and quality of life and mobility and independence as we age. As the director of wellness and longevity, I work with a lot of women in perimenopause and menopause who are experiencing fluctuations in their hormones that can universally lead to changes like insulin resistance and the development of weight gain around your midsection that was never there before and just isn't responding to the dietary and lifestyle measures that were working previously. So I use tools like hormone replacement in conjunction with GLPs to combat a lot of these changes that we see, not only physically, but with our DEXA scan, we see loss of muscle mass, we see increased body fat percentage as well as visceral fat. When I'm looking through patients' blood work, I see cholesterol increase, I see insulin resistance and changes to our metabolic health. And so these GLPs function as a really important tool in the kit to combat these hormonal changes.
For someone who is looking to lose weight and doesn't really know where to begin and is interested in a GLP-1, I think that our office would be a great place to start. We have multiple medical professionals who oversee your care, who are a phone call or a text away to answer any questions you may have. We have a nutritionist on staff. So on the aspect of losing weight, I think that the providers, myself, Kara, and Monette, do a great job of being there for the patients that we have on the medication and getting them to their goal weight. But I think a thing that separates us from other offices is that we also have all these treatments here that we offer that can help improve a person's feeling about themselves after they've lost the weight, whether that's through skin tightening or injectables or sort of the day-to-day treatments that we do at the Body Center, whether that's lymphatic massage or balance or compression suit. We can do all these other things to improve the patient's overall wellness and health while they're also achieving their goal weight. Just sort of having that combined approach from all aspects. Our patients have had great success, and we've had a lot of patients who have come from the surgical end and then have lost weight with us, or have started with the medical weight loss with us and then have gone into surgery and doing other things or doing injectables and skincare here, improving and feeling better about themselves after they get to that goal weight.
My downfall is I have 3 young children, so we always have sweets and things around the house. So I found myself eating their leftovers, which was a bad habit. I heard that Dr. Bucky offered this weight loss program for some of his patients, and I asked about it and thought I'd give it a try. In the beginning, we did an evaluation. They did a DEXA scan to kind of measure your mass. Either about once a week, and you can rotate it through some muscle areas like in your abdomen or your thighs. That's where I rotate them. My appetite is still there normally during regular meal hours, but I noticed that I'm not doing all the snacking and in between meal eating I have been.
I was heavy. I don't think I was my healthiest. I was ending a marriage, so I just wanted to feel better. And I wanted to lose weight, and obviously I had tried many times before. I heard about Dr. Bucky. I heard about him through a friend. She just said that she had had a good experience, everyone was so nice, and all true things. First of all, they prepare you, so they do all your blood work, they do everything, it's so safe. And any questions that you have, they answer, they guide you through every step of the process. It's made me more confident, certainly. I just feel healthier, happier, more confident. It's just much better, a much better way to live.
Our Bucky Black Card members do get 20% off the complete medical weight loss program and also get their weekly NAD injections complimentary. And the rest of that balance from the Bucky Black Card you can use on services here at Bucky Plastic Surgery, such as injectables or body treatments. For our medical weight loss patients, getting a Bucky Black Card is a no-brainer.
Medical weight loss patients who are Bucky Black Card holders will also receive weekly complimentary NAD shots. This therapy really complements the use of GLPs well, as it supports our mitochondrial health, which fuels all of our metabolism and detoxification and can act as a really nice adjunct to both hormones and GLP. Thanks everyone for attending. Just remember to look out for a text from us after the event and reply back to book your consultation. Now we invite you to chat for the next 15 to 20 minutes so we can answer any questions you might have about this program.